We have some of the most ambitious, passionate, driven people that I've ever seen in our generation.
Every day I'm a pediatrics resident, I am more certain of the path that I've chosen. And so I think that even though there's a decrease in numbers, I think the passion has not dwindled at all.
Something is shifting in medicine, and it's hitting pediatrics hard. Fewer students are choosing to become pediatricians, and the question is echoing across every medical school and clinic. Who will take care of the next generation of kids, and how will they do it? This episode isn't just another conversation, it's a call to action. From technology shaping tomorrow's doctors to strengthening the pediatric pipeline, we will discover how the next generation is redefining the future of pediatrics. This is Charting Pediatrics. The journey to becoming a pediatrician is full of discovery, challenge, and purpose. In this episode, we are joined by two future pediatricians sharing their own journeys to help us understand the bigger picture. Dr. Hannah Bullock is a resident, and Sarah Martin is a medical student at the University of Colorado School of Medicine. Hannah and Sarah, welcome to the podcast.
Thanks for having us.
Glad to be here.
It's so good to see you guys. I mean, this is take two because we did this live in front of many of your peers here at the medical school. And it was just such an amazing event. We thought we had to bring this to the masses, right?
I agree.
Why don't we start out a little bit with your own journey? Sarah, maybe let's start with you. You're a little bit earlier in the journey than Hannah, but tell our audience a little bit about why you're thinking about pediatrics.
Yeah, absolutely. I mean, kids have always been my favorite people to take care of. I grew up taking care of the kids and babysitting around me. And then after I graduated college, I was a medical assistant in pediatrics for a while. And kids are so interesting. They say the darndest things. And I feel like each one of them just has something so different to bring to the table, whether it be a 6-month-old or a 16-year-old. It's two very different people that you're interacting with. And I have always loved that. I think as I've been going through my clinical year this year, I've thought, what about like internal medicine? I loved my internal medicine rotation. What about family medicine or something else? And at the end of the day, it's when I see a kid that I'm so fulfilled and happy and getting to take care of them. So,
Hannah, how about you?
I think that my journey to pediatrics was a little bit different in the sense that it wasn't really linear at all. I really came into medical school unsure of what I wanted to pursue in the future. And I went into every rotation with like some sort of interest or aspect of the specialty that I really enjoyed. And my pediatrics rotation during my clerkship years was the first time I really felt like I gravitated towards a specialty. And I experienced the nuances of the unique pathophysiologies in neonatal medicine and pediatric disorders. And I also really felt fulfilled by taking care of patients and families who were oftentimes experiencing hospitalization for the first time or coming to the emergency department, which can be scary experiences. And so I really felt that draw and pull towards the specialty. But I had my doubts. I had other interests. I wasn't sure if pediatrics was the right fit right off the bat. And so I considered medicine and pediatrics. I considered anesthesia. And I actually was so undecided that I applied. I really felt like I needed more time, needed to talk to people further and kind of pick their brains on what their careers looked like, their work-life balance, their clinical interests. And so I went through the whole interview process with both specialties in mind, and really took a chance to step back and reflect on what my interests were, what my foundational training I wanted to be in. And that's what finally tipped the scales towards pediatrics. And I haven't looked back since. And now, over halfway through intern year, there's not a doubt in my mind I made the right decision.
Well, I got to know you in the last time we spoke, and I'm just so happy that you're both, Hannah, you're already a pediatrician. Sarah, you're going to be a pediatrician. And I think that's great news for the field of pediatrics. Let me just set the stage for our listeners. So what's been happening in pediatrics kind of since the 2010s is the number of pediatric residency positions has been expanding year to year, but the number of filled positions has been going down, most notably in 2024. There was a really nice rebound in 2025, but it had us all really concerned. Why are students not choosing pediatrics right now? Sarah, what are you seeing among your peers? Like, what are people thinking about when they're choosing what profession to go into?
The biggest thing I think that I hear from my peers is, I just can't deal with the parents. And part of me understands that. It can be frustrating to, when you have a mission in mind in terms of someone's care, to get some pushback on that mission. And I think that these days, uniquely, so much of the burden of care is being placed on parents. We're seeing that different organizations and associations aren't being portrayed as reputable as they once were, even if they have continued to do the work. And so more of that decision-making now falls on parents. More of that research responsibility falls on parents. That can be a lot to handle. So I understand when a parent has a point of view that's very different from mine in terms of their child's care. However, it is still frustrating in the moment, and it's hard to step back sometimes.
Yeah, what I'm hearing you say is I think there's a lot of good information out there from reputable sources that we've had in the past. There's also some misinformation or disinformation. The world has changed so much in terms of social media and those types of things. Hannah, what were you seeing in medical school in terms of like how people were deciding what to do and why not were people choosing pediatrics?
Yeah, I think from my experience, there was a couple different aspects that kind of pushed people one direction or the other that they really strongly considered. I think, unfortunately, I'd be remiss if I didn't mention the compensation aspect of pediatrics. I think that as medical students, as we're preparing for the future and having different discussions about financial planning and loan repayment, I think that pediatrics is unfortunately just one of the specialties used as an example as a lower paying specialty. And a lot of us obviously know that coming into the field, and it maybe we considered it, but we felt it wasn't a big enough deterrent to stop us from pursuing this specialty. But I think it can be challenging, especially if you have like an interest in a subspecialty already, like cardiology, for example, and you're trying to decide if you want to treat adults or if you want to do med peds and have a combination, or you want to treat kids. And oftentimes when thinking about what your life structure is going to look like, finances are a role. And so I think that is one of the factors as well. And I think something else that I personally considered was geographic location. I think that the number of academic pediatric hospitals is lower than that of adults. And so thinking about where you want to train, the opportunities for your training, also think plays into your ultimate decision on what you want to pursue.
Yeah, I think pediatrics as a whole is a lower paid specialty than others that you might choose to go into after medical school. And then among pediatrics, there's different pay scales depending on what you do. I happen to work in primary care, which tends to be on the lower end of things. I feel very fortunate that I got to choose to do that. And there are some pediatric specialties that get paid higher, mostly procedure-based types of things. But I think for our listeners out there, what types of things would you think about, either of you really? I mean, Sarah, you're a little bit earlier in your kind of your journey. Hannah, you're a little bit further along, but how much are finances playing into your decisions at this point?
I think that I was fortunate that I got to step into this journey with a partner who has a career outside of medicine. And so I had that extra layer of financial support. But it was still a big decision to make. I knew I wanted to train in a big city. I wanted to train at a large academic center. And the cost of moving without a paycheck, without loan support is a big decision to make. But ultimately, throughout the longevity of my career, I still felt that I was able to meet my financial needs with this salary. That's still a substantial salary. And even though it's lower compared to other specialties, it still is, I felt, enough to financially support myself and think about future family life. And so my passion and interest really aligned with pediatrics. And so I definitely considered it, but ultimately it wasn't the strongest deciding factor.
I really agree with that. The fact that there's so many factors to think about. I know personally right now, my med school is fully paid through federal loans, both my tuition and my cost of living. And that puts a lot of pressure on my future, thinking about home ownership, thinking about supporting a future family, thinking about possibly retiring with my loved ones. When I think about the interest rate on my loans, when I think about how that number seems to be ever growing, and I look at what compensation looks like for different fields in medicine, it is a hard choice sometimes when I think about my partner and how I want to support him and support our future children. It can be a hard choice sometimes to think, okay, I want to do pediatrics because I've sacrificed so much to be here, and it feels like I should be able to support those around me who are sacrificing in kind.
Yeah, I think within pediatrics, there's also disparate access to care depending on where you live. For example, rural areas, less access to care, and then socioeconomically too. It can be challenging for certain patient populations to get access to good care. And I think one of the things that we've learned with time is that it is good to have people from those communities who sort of are in the pipeline, who go to medical school, who choose pediatrics, who are then able to provide care in a way where they can easily identify and empathize with that experience of life. And it gets into sort of a cycle where, Sarah, exactly what you were just talking about, those same people may be socioeconomically disadvantaged, go into medical school, then have more debt, and then maybe are choosing less likely, pediatrics, and more likely some more lucrative positions. So anyway, does that resonate with you?
I would say definitely. Physicianship used to be a field where you could go in and know that you were set for life. And I think it's becoming less and less that way, interestingly.
Yeah, I agree, especially with all the other financial costs and aspects as our salaries fluctuate with economic changes as well, like housing prices change, insurance rates change. And so our compensation is keeping up, but it's definitely something that I resonate with as well.
So we've talked about finances, huge factor. We talked a little bit about some of the dynamics of pediatrics, which are to deal with parents and where their information may come from and how that can be challenging. I really enjoy, the kids mostly, but I enjoy taking care of the family as well. Are there any other factors you guys are seeing in terms of why people are choosing pediatrics or not choosing pediatrics?
I think the other thing I think about is that pediatrics is a field where you are uniquely positioned to advocate, where it feels almost wrong if you're not advocating. And that is very tiring. I think people see that as a possible source of burnout, where the work never stops. And for a lot of pediatricians, that's true, but it can be a tough pill to swallow when choosing a field to go into.
I think another aspect that I've thought about is exposure. I think the foundation of our medical school training is largely focused on adult physiology, pharmacology, anatomy, which makes a lot of sense because pediatrics is a small slice of specialties that just happen to not treat adults or very infrequently treat adults in certain specialties. And so we kind of go into our medical training with an adult mindset and have a lot of our critical exposures in adult fields. And opportunities exist to explore pediatric subspecialties, but you kind of have to seek those out as a medical student. I did a lot of my subspecialty work in cardiology and intensive care, gastroenterology after I already had the interest in pediatrics. And if I had made that decision too late, I probably wouldn't have had those opportunities. And so I think that those are also fields that were already built into my adult experience. I didn't have to seek out for myself, and that I got an opportunity to explore regardless of how I structured my education. And so I think that exposure, the structure of your medical school, and access to higher acuity pediatric training and hospitals also play into account.
Yeah, due to that sort of dip in 2024 that I was talking about in terms of the residencies not getting filled, the ACGME, the accreditation body for graduate medical education, which is for residents, actually did make a couple of changes. One of the changes was to put some of the specialty experiences earlier in the residency experience as a way maybe to invigorate a little bit more interest in the specialty overall, realizing that maybe there's, different ways to achieve lifelong goals, which you guys have both touched on. So you guys, I'm on Instagram now. I've reinvigorated my professional Instagram account.
Congratulations.
I appreciate it. Thank you. Yeah, I did it a few years ago and, just didn't keep up, but I'm really being deliberate about it. For me, I'm not a social media native. I did not grow up with it. I think you guys did, right? You grew up with social media, so you would be considered a native. How do you think that influences, approaching pediatrics for both of you? And especially, I would say, Sarah, you talked about advocacy. Is it important for us to be advocates on social media?
I think absolutely. We discount how much silence kids have to themselves these days. The answer is 0. They don't have any silence. There's always something going on, whether it be through headphones, just on TikTok, whatever it may be. And if we aren't in those spaces advocating for their health or showing them what a healthy life could be, then there are other people who are going to do the opposite. Most people over 30, if I said this sentence, wouldn't know what I was saying. If I said that clavicular got brutally frame-mogged by the ASU frat leader, do you know what that means?
I have no idea what you're talking about.
But, it's interesting because if I explain that sentence to you, it'd be a pretty benign meaning. But the social media creator that I just referenced in that sentence is someone that endorses starvation and methamphetamine use to children in order to further a physical aesthetic. So if we're giving someone like that a platform, like most of the people under 18, I would say, knew the meaning of that sentence. They know who clavicular is. And so if we are not then kind of paralleling him and showing, hey, this is actually what it looks like to be healthy. This is what it actually looks like to lead a fulfilling life. Then I'm not sure what messaging the students and kids out there are going to be receiving at the end of it.
How about you, Anna?
I mean, first of all, I don't even think I could decipher the meaning of that sentence. I don't frequent TikTok. I'm on other social media platforms. But I feel like I think about the impact of social media on the field of pediatrics from 2 lenses. One, from how we can utilize this as an opportunity as pediatricians, as an additional platform to educate our patient population, to combat misinformation, and then also as a networking opportunity with other pediatricians in different practices, in different institutions. People meet at conferences. We want to continue this exchange of ideas back and forth, and also to advocate and maybe put ourselves in contact with policymakers and lawmakers from the political lens as well. And then I think about the impact of social media from kind of the risk assessment perspective, which I feel like I think about more often, especially in the context of continuity clinic. On a weekly basis. Oftentimes when I'm assessing for risk factors, even in younger childhood or early adolescence, I think about the impact of social media on sleep, on daily activity, on overall health, on anxiety, depression, risk factors for mental health, and especially for kids with underlying suicidality, thinking about the kinds of things that they're exposed to, how they're influenced online, and being able to kind of speak their language and understand how they receive information, and understand how that plays directly into their health. I've seen kids impacted by a social media kind of catalyst that led to horrible health outcomes, both before they happened in the clinic aspect, but also in the ICU. And I feel like that for me has really shaped how I think about preventative care as a pediatrician.
Yeah, so we need to keep our fingers on the pulse.
Exactly.
To know what's happening out there. And we need to stay engaged and be a part of the conversation to make sure that our voice is heard. That's what I heard you guys saying. I was thinking a little bit about the pipeline into pediatrics, and you guys both shared your own journeys into pediatrics, but the pipeline really starts even before medical school. And there was a study that I was reading that said 42% of people who go into pediatrics know that they will go into pediatrics before they even start medical school. And so my question to you is, are there ways that we can enhance the pediatric pipeline even before medical school. So thinking about, high school students or undergraduate students who may be apprehensive about going into pediatrics as a whole, and don't even apply to medical school. Is there a way to enhance those people being more likely to go to medical school?
I think that practicing now, only being a few months or several months into residency, I've met kids in clinic who are interested in becoming a doctor. And even when in early adolescence, they're like, I don't know, it's really expensive. I don't know if I can put myself through school. And I think it's a really cool opportunity to kind of be their pediatrician and to ask them more questions and to engage them in their curiosities and to encourage them and to also try to connect them with resources that promote their learning. I think that having that role and seeing them on a day-to-day basis and keeping that excitement alive has been really important. I also had the opportunity in medical school to do some rotations at student-based health clinics at high schools. And I think just having those clinics in general is a great, not only foundation of support, but also just presence. Like you were there as a pediatrician, oftentimes an adolescent provider, but they see you in their day-to-day world. And oftentimes you are their PCP at the student health clinic and you're making a tangible impact. And I think that does resonate with kids. And I think that hopefully that additional point of contact and that consistent presence for our middle school, high school, even college students can really make a genuine impact on their overall trajectory.
Mm-hmm. I think it's so wonderful to hear about the dreams of the kids that I work with. It's so fun to hear about their passions in life, and a lot of them do want to grow up and go into medicine and become pediatricians. I think the answer that comes to mind first is always making med school more accessible. We've talked a little bit about how we want our pediatric workforce to reflect the pediatric population that they serve. And I think part of that is going to be much helped by making med school more accessible for folks, because there's tons of bright students that I've worked with in educational outreach programs that I've done that really want to go into medicine, but just don't have the capability to. So that's the first thing I think of. I think when it comes to keeping that, was it 42% that you said? Mm-hmm. When it comes to taking that 42% that want to go to med school and want to do pediatrics and showing them that this is a way that can, showing them that this is something that can fulfill their life and help them achieve their goals. I think that when they are in pediatrics clinic as patients, or even when they are learning about medicine through educational outreach programs, showing them the relational aspect of pediatrics can be really important. A lot of these kids that want to go into pediatrics are doing it because they love taking care of their little siblings. They love babysitting the community around them. And showing them, hey, this is a way you can do that, but in a clinical setting. This is a way that you can do that and come alongside families and help them grow. Showing them that aspect of things, I think, would be really helpful in encouraging them to go into medical school.
This is so great. And this is all really resonating with me. What I'm hearing you say, the pediatric pipeline starts young and maybe in our offices. I mean, that's a great touch point. And, I think too, that making medical school more accessible is super important. And then thinking about during medical school, making pediatrics a topic of conversation more. I understand all the value of, adult-centered care, of course, but pediatrics needs to be a part of the conversation earlier in medical school so that it exposes people to all the wonderful things. And I mentioned a little bit earlier during residency how the ACGME has tried to make pediatric training a little bit more enticing, but it can be lengthy, pediatric training, especially if you want to specialize. So, most people will do a 3-year pediatric residency followed by a 3-year fellowship. Do you think that's a deterrent for people choosing pediatrics?
It honestly was for me. It's something that I did think about. A lot of our counterparts in internal medicine and different critical care specialties oftentimes have like a 1 or 2 year fellowship. The ones in internal medicine, I think oftentimes they are 2 or 3 years, similar to us. But I think that the amount of clinical time in relation to the amount of research time is about 50-50 from my understanding of most fellowships and how they're structured, and is someone who sees herself in more of a clinical realm with maybe a research component, but not so much an emphasis. I think that is something I took into account and really strongly considered about the length of my training and the overall goals. Ultimately, I decided that in the longevity of my career, an additional 1 or 2 years wasn't a make or break. But I'm also someone who's thinking about an additional 4th-year fellowship. So it's definitely something that I do think is impactful, especially for people who are later into their careers, who have a second degree, who have a family. I think like adding additional years to an already long training and a long road does have an impact on the overall decision.
Mm-hmm. And I've heard a little bit about that from even my peers that want to do pediatrics, even though we're quite far away from residency still. There recently has been more talk of a pediatrics hospitalist fellowship where you do an additional year to gain insight into how a hospital works and how it looks like to run a team. And previously, that didn't used to be the case. That fellowship didn't exist. And a lot of my friends that want to go into inpatient pediatrics have been seeing that additional year as a deterrent when they're thinking about the family that they want to build and the timeline of all of that.
Yeah, I mean, fellowship gets paid lower than you would as an attending. And so you're deferring salary for however many years. It may be 1 year in some cases, it may be 3 years in other cases, but it all factors in. So it's really important. Do you guys know what you want to be or what you want to do?
I mean, I came into medical school really strongly considering critical care. I ended up dual applying into anesthesia. And so I was trying to decide, do I want a foundation in acute critical care? Do I want a foundation in pediatrics with opportunity to then hone in and diversify my clinical experience from there? When I got into residency, I was really surprised that I had a lot of other interests as well that I hadn't explored as a medical student. I ended up really enjoying my gastroenterology rotation and really found hepatology very exciting. And you do exist in the ICU world there as well. And so more recently, I've started to kind of shift my interests and explore other fields. And for that, I'm actually very grateful I chose pediatrics because it gave me that opportunity to further explore. And so my answer is I still have no idea what I want to do.
Yeah, I'm around the same. I think coming in, I was part of that 42% that really wanted to do pediatrics. And the more that I do my primary care clinic days, the more that I love it. I love a good well child check. I think it's like half an hour of getting to play with a baby and passing it off as clinical care, it's amazing. I've heard that take is a little controversial, that's not everyone's cup of tea, but I love a well child check. I love talking to families, talking to parents. So I am leading primary care. But the future is still wide open and I'm not discounting anything.
So this has been such a great conversation. I've gotten to speak to you both twice, and it's just so nice to speak to you and connect with you and get to know the next generation of pediatricians. What would you say to all our listeners out there about the next generation of pediatricians?
I would say the kids are all right, and that I'm speaking of my fellow trainees and classmates, as well as the kids that we're going to care for one day. We have some of the most ambitious, passionate, driven people that I've ever seen in our generation. And we continue to fight and to not be apathetic about the world around us, something that's really beautiful. So I'm excited to see what we can do for pediatrics in the future.
I would say that even though we've seen this drop in our census numbers for people who are choosing to pursue pediatric residency, especially in 2024, the people that have done so regardless are some of the most dedicated, compassionate people I've ever met, as Sarah was mentioning, especially within my own residency class and residency as a whole, all the way up to our attendings and our administrators. I'm inspired on a daily basis. And I think that every day I'm a pediatrics resident, I am more certain of the path that I've chosen. And so I think that even though there's a decrease in numbers, I think the passion has not dwindled at all.
Well, I'm really excited to see what you do with your career. And, sometime in the future, we'll have you back and you can fill us in.
That sounds great. Thanks for having us.
Thank you.
Thanks for all you do. And thanks for being here.